Hello, I'm Anusha Behra, an MD clerk. Today I'll be doing a breast OSCE examination in this video presentation. So before we start, first we need to introduce ourselves to the patient, explain them the conduct and the purpose of the examination, and take the patient's consent. Hello, I'm Dr. Anusha Behra. Can I know your name and age?
Mamta Ryan, I'm 21 years old.
Hello Mamta, nice to meet you. So Mamta, today I'll be doing a breast examination, complete breast examination on you. Is that okay with you? So after we are done taking the consent of the patient, we'll ask the patient to go into the changing room and undress down to the breast, and we can give them a blanket to cover themselves up, and then they can come and sit and we can proceed with the general inspection. So once the patient is done changing, now we'll ask the patient to uncover the breast, and then we are going to do the first step of the general inspection. So Mamta, can you keep your hands relaxed on your thigh and sit upright like this on your thigh? Yes, okay. So now we are going to see the breast. We are going to do overall general inspection. For that, we need to see if there are any masses or any swellings or any scars present on the breast, or if there is any skin changes like erythema, puckering, dimpling, or any pudgy orange or any kind of scars, or if there is any nipple changes like any retraction or discharge, or if there is the presence of any asymmetry on the breast. Okay, Mamta, now can you put your hands on your hip and push inwards? So here we're doing this so the pectoralis major muscle gets tense, and we're going to repeat the same general inspection that we did in the first step. So now if we note any masses, we have to see if the mass moves with the pectoralis muscle. If so, then it will suggest the presence of malignancy, and the process is called as tethering. Okay, Mamta, now can you keep your hands on your head? Look behind your head like this. Okay, now sit straight. Again in this step, we're going to look for any asymmetry, any scars or any kind of lesions or any changes present in the breast. We'll do the same inspection that we did in the first two steps. Now can you please lean forward? Even in this step, again we are going to look for the same changes or any abnormalities in the breast tissues if we can see here. If we need look for masses or anything that can be seen here. Okay, now you can sit. Now you can sit relaxed. Okay. Now we'll do the palpation of the breast tissue. So first we need to wash or sanitize our hands. And before we touch the patient, we have to make sure their hands are warm, or we could use gloves also. So for the palpation, we'll ask the patient to lie flat on the bed or at an angle of 45 degrees. And we'll ask the patient to keep the one hand behind their head of the side being examined. We'll start examining the normal asymptomatic breast first. So at first, we are going to squeeze, we'll do a nipple examination. So for that, we are going to squeeze the nipple gently and look for any discharge. And if any discharge is present, we have to note the color, the amount, the consistency, and the order of the discharge. So after the nipple examination, we have to palpate the breast tissue. So for that, we need to have a systemic approach to make sure that all the part of the breast tissue are examined. And here we're going to use the spiral method. So for that, we are going to start at the nipple and work it outwards in a concentric circular motion. And for that, first we're going to use the finger pads of the three fingers of one hand and press the breast tissue against the chest wall and feel for any masses. We're going to press it downward in a concentric circular motion and apply steady pressure down to the chest wall. And we have to keep applying enough pressure to be able to palpate up to the 3 levels of depth: the superficial, the medium, and the deep level of the chest wall. So if any mass is found, then we have to describe it according to its position, as it lies in which quadrant, the shape and size, if it is irregular or elongated or spherical, and also the fluctuance, the consistency, if it is firm, smooth, rubbery or spongy, and the mobility of the mass, if it is any noted. And then after that, we are going to proceed with the examination of the axilla. For that, we are going to again use a free hand and assess the entire apex, the anterior, the lateral, the posterior, and the medial sides of the axilla, including the apex of the axilla, and note for any abnormality. And we'll end this with a general lymph node examination. For that, we are going to palpate the cervical nodes, then the supraclavicular lymph nodes, the infraclavicular lymph nodes, and then the peristernal lymph nodes. So after we are done with the breast examination, we'll allow the patient to rest, and then we're going to explain the findings of the procedure and entertain if the patient has any question and answer them accordingly. And at last, we have to thank the patient for their effort. So in this video presentation, we're going to show how to do Leopold's maneuver. And this maneuver is basically done to determine the fetal presentation and the position by systemically palpating the gravid abdomen. So again, as we did in breast examination, we'll introduce ourselves to the patient and ask their consent and explain them the procedure. And then the patient is advised to empty their bladder first. And then we'll ask the patient to lie down on the bed, and we can use a pillow under their head for their comfort. We have to make sure the patient is strapped appropriately to maintain their privacy. Now, before we touch the patient, we have to make sure that our hands are warm, because cold hands might stimulate uterine contractions. So once the abdomen is exposed, we have to note the presence of any scars or lesions from any past surgeries or operations, or if there is any presence of striatum gravidarum or linea nigra. And here, so before we proceed to the Leopold's maneuver, I'm going to show how to do a fundic height measurement. So for that, we need to take one end of the measuring tape and place it over the symphysis pubis and take it all the way of the uterine curvature until we reach the fundus. Okay, so the height measured in the measuring tape in centimeter will be then equal to the approximate fetal age. So now we'll be doing the Leopold's maneuver 1, which is the fundal grip. For that, we need to stand on either side of the bed, facing the mother, and then we are going to cross the uterine fundus with both the hands, like this, and palpate it in this order. We are doing this to determine what fetal pole occupies the uterine fundus. The fetal head will feel much firm, round, and hard and movable, whereas the buttocks will feel softer and smoother. And this one will be represented as LM1 cephalic or LM1 breech. So moving on to the LM2, that is the Leopold's maneuver or the umbilical grip. So in that one, we again stand the same way as we did in LM1, but here we're going to use both the hands and place it on both the sides of the abdomen. Keep one hand steady and palpate it from the other side like this. We are doing this to assess the fetal back, which side has a fetal back or which side has smaller parts. The fetal back will feel much firm and smoother, whereas the smaller part is going to feel small irregularities or like small protrusions. Again, we're going to do the same thing on the other side, keeping this hand steady and palpating on this side. Once the fetal back is assessed, we can determine the fetal heart tone by counting it through stethoscope or the Doppler. So if the fetal back is on this side, so we can use a stethoscope to count the fetal heart tones. So the LM2 will be represented as LM2 fetal back left or fetal back right. So for the Leopold's maneuver 3, which is the Paulick's grip, here we are going to stand the same way as we did in LM1 and LM2. But here we're going to use a thumb and finger of one hand and grasp the lower portion of the uterine pole like this. And we're going to move it sideways, up and down, to see if the fetal presenting part is engaged or not. So if not engaged, then we can feel a movable mass, a movable body part in fetal body part. So if it is the head, then again it's going to feel firm, hard and round and palatable, movable. But if it is a fetal breech, it is going to feel softer and bulkier. So we're going to report this LM3 as LM3 cephalic or LM3 breech if the fetal presenting part is unengaged. So lastly, for the Leopold's maneuver 4, which is the pelvic grip, here we are going to reverse the position as we are standing. Now we have to face the mother's pelvis like this. Now again we are going to use both of our hands and place it on either side of the lower pole of the uterus like this and move it downwards like this to determine which side has a cephalic prominence and also to correctly identify the fetal attitude. So here, if the head presents, then one hand is arrested sooner than the other one by a round movable body, which is called as the cephalic prominence, and the other hand will descend deep into the pelvis. So if the cephalic prominence is on the same side as of the smaller parts, then the fetal head is in a flexed position, while if the cephalic prominence is on the same side as of the fetal back, then the fetal head is said to be in extended position. So now after we are done, we'll cover the patient. So once the procedure is done, we are going to explain all the findings to the patient and answer to all the questions that they have. And at last, we are going to thank the patient for the cooperation. Thank you.